Well, good morning, everyone, and let me begin by thanking Dr. Stephen Safyer and the team here at the Montefiore Medical Center for their hosting us today, and most importantly for their commitment to the health and well-being of fellow New Yorkers. They have been real crusaders, real leaders in combating the obesity crisis in our city, a crisis that is particularly serious here in the Bronx. Now, the good news is that that the awareness of this problem is growing, and so is the moment for tackling it. And as we speak, many of you know, First Lady Michelle Obama and Walt Disney CEO Robert Iger are announcing that Disney will no longer air ads aimed at children for products that contain large amounts of fat, sugar, or sodium. And that really is encouraging, and hopefully Disney will start a trend. But we can't sit back and wait for others to act. We have to take responsibility for the problem and take action ourselves. This is a health issue that hits close to home for so many Americans. Nearly all of us have struggled to maintain a healthy weight or know someone who has. And I can tell you from personal experience, particularly as you get older, it is a struggle. Eating a healthy, balanced diet, finding time to exercise, and maintaining the commitment to both, not for a few months or years, but throughout one's life, is a real challenge. And if you lose the weight only to gain it back, you get discouraged and lose hope. And our administration is saying to every New Yorker, you are not alone. We are absolutely committed to doing everything in our power to help you get on track and stay on track to maintain a healthy lifestyle. Because this isn't your crisis alone, it is a crisis for our city and our entire country. Let me just give you a few facts to see how serious this crisis really is. 58% of New Yorkers citywide are overweight or obese. In the Bronx, it is 70%. That is 630,000 Bronx residents who are at greater risk of developing a host of diseases and conditions, including type 2 diabetes, cancer, hypertension, heart disease, kidney disease, liver disease, joint problems, and blindness. Of course, obesity doesn't just affect adults. Among New York City public school students, nearly 40% are overweight or obese. Each faces a higher risk of developing all the diseases that I mentioned, and tragically, each also faces a greater risk of early death. In fact, obesity is the second leading cause, just after smoking, of preventable death in our city. An estimated 5,800 New Yorkers die each year because they are overweight or obese. Now, for decades, smoking was seen as an intractable problem and one too big for local government to address. But over the past decade, smoking among adult New Yorkers has dropped 35%, resulting in more than 450,000 fewer smokers in our city. And estimates tell us that that means 50,000 fewer smoking-related deaths by the year 2052. Our success in cutting smoking deaths to record lows shows that we can tackle the toughest public health problems head-on and make a huge difference, but only if we are willing to act boldly and to target the problem comprehensively. And that's what our administration has done with smoking, and that's what we are doing with obesity. We're confronting the obesity epidemic on several fronts. That includes our most recent proposal to curb consumption of sugary beverages. Sugary drink consumption is a key driver of the obesity epidemic in the United States. In fact, we get more excess calories from sodas and other sugary beverages than from any other single source. What's worse, these are empty calories that flood our bodies with sugar without making us feel full. Many New Yorkers don't realize that a 20-ounce soda has the equivalent of 16 packs of sugar. And that's why we are combining our new reform limiting the serving size of sugary drinks with an expanding public education campaign. It builds on the work we've already done to give New Yorkers more information, like calorie counts in restaurants, so that they can make better choices about the food they and their families consume. We've also provided New Yorkers with healthier options, including creating healthy bucks that can be used to purchase fruits and vegetables at farmers markets, and making hundreds of green carts available across the city so that families have more access to fresh produce. And if you walked in and you noticed, there was one right outside today with a number of people standing there buying stuff. In addition to the tragic human toll, Obesity is also placing a growing burden on public finances. People say, why should I care about this? I'm not overweight. Well, obesity costs New York City alone roughly $4 billion each year. Nationwide, that number is $150 billion each year, and the crisis is only getting worse. Hospitals like Montefiore have realized that we simply can't treat the effects of obesity. We must help people change their lives before they ever need to enter a hospital. Montefiore has made providing their employees, patients, and visitors better access to health foods a priority. They're also educating children and their parents to make healthier food choices, and partnering with local groups to host farmers markets and with the city to offer exercise programs and cooking classes. Now, we'll be working with a range of partners throughout New York to do even more. As the report we released on Thursday detailed, our administration refuses to stand on the sidelines while millions of our fellow New Yorkers struggle with the health implications of being overweight or obese. And I want to thank Deputy Mayor for Health and Human Services Linda Gibbs, Health and Hospitals Corporation President Ellen Aviles, Department of Environmental Protection Commissioner Carter Strickland, Food Policy Coordinator Kim Kessler, and Department of Education Deputy Chancellor for Operations Kathleen Grimm, who are with us today and serve on our administration's obesity task force, as well as the Deputy Mayor for Operations Kaz Holloway and Schools Chancellor Dennis Walcott for their leadership in addressing this crisis. Now, I would like to welcome the man who spearheaded our administration's efforts, the only doctor in New York with 8.4 million patients, the Commissioner of our Department of Health and Mental Hygiene, Tom Farley. I'll stand here, I won't block you.
Thank you, Mayor Bloomberg. I'm here today as the city's health commissioner, but also as a pediatrician. As a pediatrician, when I see a single child that weighs 300 pounds, I get upset and I get angry. Upset because that child is already struggling to walk, already has pre-diabetes or maybe even diabetes, already has narrowing of the arteries to the heart, and is on track to suffer from various chronic diseases like diabetes for years, getting complications like amputations, and then to die decades before his time. And angry because none of it is this child's fault. And angry because his current and future suffering is entirely preventable. It's not fair to ask a child to overcome the marketing of a multi-billion-dollar industry. It's simply not a fair fight. Now, in New York City, there's not just one child that weighs over 300 pounds. There are many hundreds of them. And that's just the tip of the iceberg, in which in kindergarten through 8th grade alone in New York City, we have 250,000 children who are overweight and obese. All of these 250,000 overweight and obese children are at much higher risk to live for years with diabetes, possibly getting amputations, vision problems, and kidney failure. Now, there are many factors that contribute to this problem, but none as important as sugary drinks. Over the last few decades, sugary drinks have grown nearly tenfold in size, from a 6.5-ounce bottle to a half-gallon tub that delivers nearly 800 calories. They're everywhere, they're cheap, they taste sweet, and when you drink them, the calories go into your system without making you feel full, so they tend to be just added to your diet. In the obesity era, these massive portion sizes of sugar water are slow killers. Now, we can just get angry about this or we can take action. I believe we should act. As the Health Commission who is paid to protect the health of New Yorkers, I believe it is our responsibility to act. The City Obesity Task Force has put forward some 20 initiatives to promote physical activity, make healthier food more available, and reduce the overconsumption of unhealthy food. Most important, though, we are proposing a very simple solution to this problem of overconsumption of sugary drinks. Make the portion sizes more appropriate for humans, and then let people choose how many portions they want. Now, this will help not only children, but also adults, because it is difficult even for adults to judge portion sizes. And studies have shown repeatedly that adults given larger portion sizes just consume more without recognizing it or compensating for it by eating less later. Now, people have the right to drink as much as they want, but they should be given a warning signal in the form of a portion size of what would be the maximum that experts say a person should consume at a single meal. Now, there are many questions about the detail of this rule, but the key answer to all of them is this. When hundreds of thousands of New Yorkers are suffering from preventable illness and thousands a year are dying from preventable deaths. We have a responsibility to protect them. Thank you.
Well said.
Tom, thank you. Public Advocate Bill de Blasio is someone whose support on this important issue we are certainly glad to have. Bill's job is to advocate for the public, and I think he really is doing exactly what's right here. Bill?
Thank you very much, Mr. Mayor. Mr. Mayor, I want to first echo your appreciation for Steve Safyer and his extraordinary team here at Montefiore, and thank you for hosting us today. Mr. Mayor, I've got to tell you, I have a lot of appreciation for the approach you've taken to public health over these last 10 years. It's fair to say from time to time we disagree on some other issues, but I think you have consistently set a visionary approach on areas of public health, starting most notably with the smoking ban, but in other areas as well, and I've been very honored to support you in those areas. Tom Farley has done something which is extraordinary, not just in this policy, but in following up in the footsteps of Tom Frieden, who I thought did an extraordinary job here. So this now reminds me of the fact that not only does the New York City Health Commissioner by law have to be a doctor, but they should in fact always be named Tom. I think there's a clear trend there. But the bottom line here is that this is the most personal of issues. And you heard these extraordinarily sobering statistics about what this is doing to children. I want to tell you my own personal perspective on this. And Mr. Mayor, we took a poll on this issue in our own home in Brooklyn, and you got the majority on this, I want you to know. My wife, Charlene, was instantly with you. My son, Dante, at age 14, showed an enlightened understanding of public policy and was with you right away. My daughter, Kiara, complained that when her friends and she go to the movies, they like to get the biggest available soda and then share it as a way of saving money. And she thought it was unjust to change it. And I realized that's exactly why we need to change this, because we don't want them getting the biggest available soda. The bottom line is any parent can tell you, and we fought this fight at home, that you go into a grocery in this city, a deli, a bodega, and you see line upon line of sugary drink. You go into a fast food restaurant and you get the option of a really huge cup, and every child is attracted to that maximum opportunity for sugar. And parents fight it every single day. But the business dynamics actually make it a lot harder for parents to do their job. The bottom line is parents in this city need all the help they can get weaning these kids from these drinks. And it's not easy to parent in New York City. And I think what the mayor and the commissioner are doing that makes a lot of sense here is we're saying we're going to make it a little bit easier for parents to do their job. We're going to make it a little bit harder for kids to reach for the maximum amount of sugar. And we're going to start to change consciousness in that equation. And I think the announcement you heard today from Disney is part and parcel of this. Sometimes government has to help the private sector to get on a better path. And Commissioner Farley noted that there is some encouraging news from the beverage industry in the last year or two as these issues have come up. But government has to lead the way and keep that momentum going. So I am really pleased to be here. I thank the mayor, I thank the commissioner, thank Borough President Stringer and everyone who's a part of this. Forgive me that I have to go to another engagement now, but I think this is something, as with the smoking ban, that we'll look back on in a few years and say, you know what, this was an important moment where we took a step in the right direction. Thank you.
Good. I now have to readjust the microphone from the Farley de Blasio height to the Stringer Bloomberg height. Scott Stringer is the borough president of Manhattan, and my hope is that he can convince the other 4 borough presidents to also do what he has done. He has always made healthy eating a priority of his agenda, and we're pleased to have his support. Scott?
Thank you, Mayor. Thank you. Thank you very much. Just move it up a little. Just saying. If public health is our goal and obesity is our enemy, we must be creative and aggressive to fight and win this war. And that's why today I commend Mayor Bloomberg for drawing the line in the sand and taking on the soda cartel that is driving the obesity epidemic in this country. Childhood obesity is a killer. It leads to heart disease, type 2 diabetes, asthma, and sleep apnea. 1 soda per day adds up to 50 pounds of sugar in a year. New Yorkers, have to understand that this fight is a fight for our children. It's a fight to make sure that New York can begin to become the biggest, healthiest city in the world. And in order to do that, we have to face a couple of realities. The first is, we New Yorkers don't like to be told what to do. We like to argue. And when it comes to diet, we argue with ourselves and with our families every day. Don't eat the second piece of cake. Stay away from the bologna. Stop eating and drinking all of that unhealthy food, because if you do, you're not going to lead a healthy life. We have this discussion all the time. But the mayor's proposal today takes us to the next level. The next level is to debate public health policy in a very responsible way. When I was growing up in New York City, we would play in the schoolyard, and then we'd all go to the local store, and everyone would say, let me get a 16-ounce, because that was the biggest soda. Everyone wanted the 16-ounce, the big bottle. If we had to bring soda home, we brought home the 32-ounce and the 64-ounce to share with everybody. Today, our kids are going in, they're not worried about the 16-ounce. They want the 32-ounce, the 64-ounce, the 80-ounce. They want it for themselves. And that's something that is dangerous to their health and well-being. So I respect the fact that we're having a debate. I respect the fact that New Yorkers are going to debate this issue. But the bottom line here is public health professionals and elected officials have to step up and educate and make controversial proposals so we can all learn more about this issue. Mayor Bloomberg's proposal is now a national proposal. He used his bully pulpit in a way that will create a very important health debate in this country. We have to stand with him on this, regardless of polls, regardless of political consequence. If it was up to me as a parent of a 5.5-month-old son, I would allow him soda on his 18th birthday, because I want him to lead a healthy life. So thank you, Mayor. Thank you, Bloomberg administration. We're going to work with you on this issue. It's very important.
Scott, thank you. Just to put something that Scott said, I'm a little bit older than him. When I was a kid, 6.5 ounces was the standard size drink that you got. Not 32, 6.5 ounces. And one of the soda companies ran an ad, a size that serves 3, how big was the size?
16 ounces.
16 ounces. They used to run a thing, serves 3 people. Anyways, Alan Aviles is the president of the Health and Hospitals Corporation. HHC, as you know, is the largest municipal healthcare organization in the country. It serves 1.3 million New Yorkers. Al, you want to tell us what's going on?
Thank you, Mr. Mayor. Let me just reaffirm from the perspective of our city's public hospital system just how real this epidemic of obesity is and its impact on patients and healthcare costs. It is highly correlated with a literal tsunami of chronic disease that we see every day in our hospitals and health centers. Surging numbers of patients with diabetes, with severe hypertension, with congestive heart failure, all of which have very serious consequences for patients, their families, and society at large in terms of the costs that are entailed in providing treatment to these patients. Diabetes is the leading cause of adult blindness, the leading cause of amputation of lower extremities, of kidney failure. If you look at the number of dialysis centers in this city, more than 125. The number in this country, 5,500 and increasing every week. It is an indication of what is happening in terms of obesity-related chronic disease. HHC, in fact, is entering into a contract imminently to increase its dialysis capacity by 25% to better meet the needs of its community. Obesity is clearly a complicated challenge, but there's no question but that helping patients to control portion size for soda and sugary beverages, which are calorie-laden but largely devoid of nutritional value, is absolutely a step in the right direction.
Alan, thank you. Stephen Safyer is the president and CEO of Montefiore. Stephen, you want to tell us what's going on? Oh, you are, sorry.
Sure. I actually think of the mayor as very tall.
You're right. There you are.
I want to welcome you here.
Thank you.
We are honored that you have come to have this important press conference at Montefiore. I think you and your administration, Deputy Mayor Linda Gibbs, Dr. Farley, Commissioner Farley, my colleague, President Alan Aviles, knows how committed Montefiore is to the Bronx, to the health of the Bronx, and to the children. And I should have known, that a mayor who's so grounded in facts, statistics, and versed in public policy would have given my speech. So I'm abandoning my speech. But I do want to say a few things of great praise to you. I believe that this mayor, our mayor, is the greatest single mayor in recent history for public health issues. And I have been dazzled with your command of outcomes. So your policies are not uncoupled from what it does. Smoking, trans fats, and a number of other issues that you have taken up so strongly, I believe have led the way, as others have said, for the country. And when I think about what happens in our children's hospital, which is just over that way, where we take care of the majority of the children in the borough, and what has begun to be probably the most significant public health crisis the country has faced since HIV and tuberculosis, probably far more dangerous. And when I think about what happens there and what the clinicians there tell me on a daily basis, which is that we have children, it was made reference before, who are 10 and 11, who are not just heavy, they are grossly obese. And they are on track to be at 14 or 15, what we used to call adult onset diabetes. It's a misnomer now, because these are children with type 2 diabetes. And what we have read and learned recently is that they have a kind of diabetes that is even more difficult to treat than the adults who get diabetes in their 50s and 60s. So this is a crisis of huge proportion. So I believe strongly that the smokescreen of civil liberties around an emergency of the public's health is just that. It's a smokescreen, and you have banned smoking in public places. So I believe that everybody here and everybody in the city is behind you when they really think this issue through, and we applaud you.
Stephen, thank you. Philip Ozuah is Montefiore's chief operating officer. He's also a physician-in-chief of their children's hospital, and as a practicing physician has seen obesity's devastating toll firsthand. And I'd like to invite him to share a few words.
Thank you very much, Mr. Mayor. We first saw Javon last year, and he was 13 years old. He was about 5'2" tall, and he weighed 260 pounds. He had adult onset diabetes. His blood sugar levels based on blood tests showed that they had been extremely high for the past several months. His diet consisted of, among other things, 3 large bottles of soda every day. His BMI, his body mass index, was nearly 40. So we recommended one medicine for him: lifestyle modifications, primarily substituting water for the bottled sugary beverages. We saw him 2 months later. He had lost 10 pounds, and his blood sugar was now almost normal. The story, however, does not have a happy ending yet. We saw him again 3 months after that, and he tells us that he had gone back to drinking his sugary beverages, 3 bottles a day. He had regained the weight that he lost, and his blood sugars were again extremely high. He ended up having to be admitted into hospital. We see scores of Javons every day in this hospital. And we know what their future holds. And we believe that there comes a moment when one must act, and act in the public health's interest, and act with courage, with vision, and with dynamic leadership. We've observed in our hospital a 40% increase in the number of diabetic patients being treated as children. And this is only in the last 24 months. We believe that the moment to act has now arrived. And that's why, on behalf of all of my colleagues here at Montefiore, we thank you, Mr. Mayor, for your dedication to a healthier New York, and for the courage and the leadership that you have shown on this matter. Thank you, Your Honor.
Philip, thank you. I should point out that in the end, the real heroes here are Deputy Mayor Gibbs and Commissioner Tom Farley and HHC President Alan Aviles, because they're the ones that really I depend on. They're the ones that give me the information that when we talk about it, they're the ones that can express what things really are important to people in America and in New York, and things that we can do in a practical sense to make things better. We can't just wave a wand and overnight change everybody's behavior, but we can do some things to inform them, encourage them, incent them, and this is one of the things that is going to do exactly that. Nobody's suggesting we take away your right to drink as much full sugar drink as you want, simply that we give it to you, make sure that you get it in proportions so that you can understand that if you have one, it's a good time to stop. If you want to go for two, you're okay to do that. That's up to you, and we recommend you don't, but nobody's taking away any of your rights. And I think all of the studies show that when presented with smaller portions in front of you, your behavior changes and you just take the smaller portions. Pat Wang is the president and CEO of HealthFirst. It is a not-for-profit plan that serves close to 600,000 New Yorkers. And I would like to invite her to say a few words on today's announcement. Pat?
Thank you, Mayor. Thank you very much. HealthFirst is a health insurance managed care organization. What we do is coordinate and pay for the care of our members, who range from infancy to extreme elderly. You've heard all of the effects here today. I think it's incontrovertible. The scourge of obesity, the health-related misery that imposes on people who suffer from obesity, and we see it every day with our members. Not just the direct costs of obesity-related medical conditions, but also the indirect costs, elderly patients who can't go home from the hospital directly to their homes without stopping first in a nursing facility for rehab and then going home for home care because they cannot manage on their own because of their size. The impact on their families, who are deprived of the company and the loving care of family members who suffer from this. Nobody wants to suffer from this. Nobody wants the medical conditions, both direct and indirect, related to it. And that's why we really applaud the mayor's initiative this morning and thank you for taking this very important step in the public to try to get at the root cause of this and to help people to avoid this terrible situation in the first place. The other thing, and it has been mentioned, dollars, all of these dollars associated with obesity and obesity-related conditions, $4 billion a year in New York City alone, according to Dr. Farley's agency. that cost is not borne just by a couple of individuals. That cost is borne by everybody. It's borne by everybody here as you pay higher health insurance premiums to help cover the cost of obesity-related illness. It's covered by taxpayers who are helping to build all of this stuff to treat obesity-related illness, and it's paid for mostly by human suffering and by individuals. Just from a pure dollars and cents perspective, I think it's very important for everybody to keep in mind these are dollars that cannot be spent, therefore, on other things that the public needs, whether it's healthcare, education, other priorities of society. We need to help people live the healthy lifestyles that we know they want to live, and we view the mayor's initiative as being a hugely important step in this direction. And I want to also comment on the mayor's stature. I think that you're a giant, Mayor Bloomberg.
Thank you very much.
And I thank you. Really, we are lucky in New York City for having a mayor who cares this much about health care. And I just want to thank you, Dr. Farley, and your whole team.
For that, you get a kiss. Let me try to summarize today's announcement for our Spanish-speaking New Yorkers. Nuestras comunidades se enfrentan con una crisis de obesidad. Las bebidas azucaradas son el contribuidor más grande a este problema, el cual mata a casi 6,000 noriqueños al año. Por eso es importante que todos tomemos mejores decisiones con nuestras bebidas. And with that, we'll be happy to take